America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can learn more about us by going to the website, americashealthcareadvocate.com, americashealthcareadvocate.com. Send me an email if you've got a question or comment. I'll be happy to respond to them. Oh, and by the way, thank you all of you who liked the shirt, okay? The Psycho Bunny shirt. So I'm wearing it again. Just want to let everybody know that I listened to what you said. Additionally, if you want to follow the show or tell somebody about the show, we have the YouTube channel, America's Healthcare Advocate, 16 podcast channels, including Rumble, which we just added. So the show is out there. We've got about 500,000 views on YouTube, and I don't know what, Dave, where we're at on the podcast. It's a couple of 100,000, I think. And so it continues to grow. This show today is probably one you might want to go up and listen to. I think you're going to find it pretty interesting. In studio with me today, Dr. Monique Gary. She is the Chief Medical Officer of Bexa, and Elizabeth Vire. She is the Chief Revenue Officer of Bexa. Welcome to both of you.
Thank you.
Flying in here from Philadelphia to be with us today. I really appreciate that. And you canceled a trip to get back here in time to be on the show. So thank you both for doing this. So this is a show that we've talked about. I've talked with Elizabeth about for some time. When I met her and we talked about this program, what they do, the technology, I was floored by what it is. We try very hard on this broadcast to bring you things that are leading edge medical technology, leading edge cures that are being explored, things that are being done that are sometimes out of the box, like the Wavi brain scan, like the Neuro 20. Well, this device is very much like that. It's all about breast cancer. And it's all about why this device can do a better job than the conventional way we're treating breast cancer and the conventional way we're looking to find out whether women have the beginnings of breast cancer, late-stage breast cancer, whatever it is. We're going to explore all that today. You're going to learn a lot. Obviously this show is directed toward women who have issues or may have an issue or have concerns. But if you're the husband, you're the father, whatever the case may be, you've got a woman in your family who may be at risk, you want to listen to this show. So let's just start, Elizabeth. So let's talk about Bexa. It's an international company. Mm-hmm. You're here in the United States. You're in Colombia, South America, Saudi Arabia, Indonesia. That's pretty significant. Let's talk about what Bexa is and how it works.
Absolutely. Well, I always like to first start off with what Bexa is not, just to make sure we're very clear from the very beginning. So Bexa is not a competitor to mammography. For those women above the age of 40 who are currently getting their annual breast screenings, it's amazing. Keep doing what you're doing. Bexa is also not a mammogram solution. So Bexa is an alternative to mammography. We are here to help close the annual screening gap in two ways. One, for those above the age of 40 who are not getting their annual breast screenings today due to pain, radiation, inconvenience, delayed results, and dense breast tissue. And then two, for those who do not currently meet the age guidelines of mammography unless they have some type of family history in most cases. So Bexa is a painless, radiation-free breast exam. We have our examiners who are certified breast sonographers come on site to an employer's location or to an on-site clinic to provide those exams that last no longer than 30 minutes. So very in and out, again, convenient, and we have accurate and immediate results. We're also density, fibrocystic, and breast implant independent, and we service men and women above the age of 18. And again, you can be pregnant, breastfeeding, because we are radiation free. So we really try to close that gap again of annual breast screenings, but then we remove all the barriers as to why women do not receive their annual breast screenings or can't today.
So doctor, how did this come to be? I mean, we spent 2.5 hours last night over dinner. We had a wonderful time. And I learned an enormous amount. And I've done a lot of research, a lot of work to get these shows ready. So who was the brainchild behind all of this to bring all this together? And because it's completely different than what we're doing now.
Oh, it's completely out of the box, but it's not entirely new. So the concept, the way Bexa works, is a process called elastography. So it's looking at the stiffness of the breast tissue. An easy way to think about that, it's like a sponge, right? If your fingers are gliding along a sponge, it's spongy, it's spongy, it's spongy. If it hits an olive pit, all of a sudden there's something stiffer in the tissues. So that concept has been around since the 80s, really 1986, where we used to use that for finding cancers in the liver. Now, where it gets really interesting, and this is the storytelling part of this conversation, we're telling stories a little early, is that it was developed and innovated by a gentleman from the Harvard Robotics Laboratory named Jay Song, whose mother had some breast issues, and she was very reluctant to get her mammogram. And he was working on the robotic haptics, like the fingers, you know, how hard you press on the phone and what happens as a result of that. And he said, why can't I take this type of technology and put it into something that's not radiation or something handheld to find masses in the breast? Like, that's what we should be doing. And that's how Bexa was born. It was initially called Short Touch. And so back in the late 90s, early 2000s, if you look up some things, you'll see a little bit on Short Touch. But the email address, when you'd get an email from Short Touch, was shorttouch.me, Short Touch Me. And
hold on a minute. There could be a problem with that.
Our CEO, as he evaluated this technology, because we didn't invent it, right? We acquired it. And as he looked to acquire it, he said, well, that's got to go. So what should we call it? And he began to do tremendous amounts of market research with women, and they said, we need a better breast exam.
Better breast exam.
Hence, Bexa was born.
And that's how it all came to be.
Indeed.
So let's, Elizabeth said a couple things that are interesting. Age guidelines. So one of the things that I thought was interesting when we looked at statistics was the number of women not getting exams. Mm-hmm. How much of that falls to women that are below the age where they qualify to go in for the mammogram. And older women, I had this conversation with my wife. I was talking about all of this when I was doing show prep over the last 3 or 4 days. She said, gosh, I haven't had a breast exam. I don't even remember when. She's 76. Mm-hmm. So let's talk about that. Why is that piece important? Why is it being overlooked? There's a huge gap there. Let's talk about that, Doctor.
Oh, boy. So you've opened a can of worms here, right? With the preventive task force.
I'm good at that, by the way.
You are.
Yeah, I'm not good at getting them back in the can, but I'm really good at opening it.
This one's not going back in the can. So, there are clinical guidelines, meaning what doctors think women should do to check every year to make sure they're okay and that they don't have breast cancer. And then there are other guidelines. There are guidelines developed by folks who maybe don't do anything in the breast cancer space. They're not oncologists. They're not breast surgeons like myself. And that's where the preventive task force sort of falls in. So the task force gives us some recommendations on when women at average risk should start screening. And every society, every major medical society does the same thing. And they say women who have average risk, no family history, right? They don't have any radiation exposures, any of the other things, no mutations in the genes, start at 40. And we say go every year until your life expectancy is less than 10 years, right? Now.
Well, so stop. How the hell do you know when your life expectancy is less than 10 years? That's the part where I'm like, wait a minute.
Precisely. That's not the only gray area.
My wife's 76 years old. I thoroughly believe she's going to make it well past 86. Mm-hmm. Why? I'm lost here.
Well, get this. You're not the only one. So are all the doctors, because the task force says stop at 74. Once you hit 74, you don't have to go anymore. So there are women who are 75 who are vibrant, who play golf and pickleball every day. My Nana was 99 and driving, and she's wearing her lipstick, right? I got a long life ahead of me. Why should I stop at 74? So there's a lot of confusion in what we're recommending to women, and it trickles down. The docs are confused, the women are confused, and you know what it means? Things are getting missed.
Yeah, things are getting mixed and things are being missed, okay? And that's one of the reasons why we're doing this show today, is we're going to talk about those gaps, what needs to be done. Why is this technology different? Why do women prefer this technology when they are exposed to it versus getting the mammogram? Is it easier? Is it more convenient? What does that mean? And we'll talk about some other things. But when we come back from the break, we're going to talk about what we call the Bexa Solution. So we'll come back from the break, we'll talk about the Bexa Solution, and we'll start getting into the weeds on how all of this works and what you can expect if you want to connect with these folks and learn more about their product and their services. So the website is mybexa.com, mybexa.com. You want to call them? You can actually do that. 1-888-469-2392. 1-888-469-2392. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Don't go anywhere. The doctor's in the house. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. I want to say hello to our newest affiliate, WZGM AM and FM 96.1, Asheville, North Carolina. I want to thank Brian Siebold there. He is the program director for putting us on the air. Very happy to be in Asheville, North Carolina. Hope you all are doing well down there and recovering from that horrible flood and all the difficult times you had. But welcome to the family. We're glad to have you on board. In studio with me, Dr. Monique Gary. She is the Chief Medical Officer for Bexa, and Elizabeth Vire, she is the Chief Revenue Officer. Dr. Gary completed her medical degree at Philadelphia College of Osteopathic Medicine, her general surgery training at UMass, followed by breast surgical oncology fellowship at Georgetown University Hospital. She holds multiple faculty appointments. Associate Professor of Surgery, PCOM, Temple University, Associate Professor of Health Equity within Dartmouth University, and a Fellow of the American College of Surgeons, Society of Surgical Oncology, and a master's degree in molecular biology. Probably knows a little bit about the topic, right? Elizabeth Vire is the Chief Revenue Officer. She has 15 years experience with revenue growth, leading high-performance sales teams, optimizing the market strategies. And what Elizabeth brings to the table here, and we're going to talk about this later on. We're going to do another show where we're going to talk a lot about what this means. And this is Elizabeth's forte. What does this mean to self-insured employers? What does it mean to TPAs? What does it mean to groups that want to reduce their overall costs? That's where Elizabeth's going to really shine in terms of discussing that. This is where her expertise is. So 2 experts in here today. Very happy to have them. All right, you said something when we went on break. Why do we need more solutions? Why do we need them?
Well, it's not because the current one doesn't work, right? We all know mammograms save lives. Colonoscopies save lives.
Yes, they
right?
do.
Pap smears, all of these things. So in the breast space, mammograms have been around since the 60s. But have the numbers of early detection gone up?
No.
To a point, and then they drop back down. And the reason has a lot to do with why women aren't getting this one test that they know saves lives. If 1 in 8 of us would get it, if we would get this, we might find something early, right? No woman ever said, hey, if you add contrast to that, I'll do that. Right? Give me an IV now, right? Or if you add 3D, sign me up for it. Oh, AI? Now I'm going to stand in line for it. There's something wrong with the process of mammography that's off-putting to women. And so when those numbers are stagnant, no matter how many Super Bowl commercials we all sponsor and how many pink outs we do.
And they wear the pink shoes.
They wear the pink shoes, right? I got my pink shoes
yeah.
on. I love my pink. It's not moving the needle. And so what that means is there's an opportunity for innovation to fill those gaps. Not only that, the cancer of yesterday is not the cancer of tomorrow.
What does that mean?
Meaning, in my practice, I'm seeing women who are younger and younger, school teachers in their 30s. I'm seeing folks in their 20s get cancer, and all the statistics are showing 29
Yet the
to
guideline
39.
is 40 and above.
Guidelines 40 and above.
So we're missing that whole class of women.
And so what we say, we'll get your risk scoring and know your family history. 80% of those young women have no family history of breast cancer.
Wow. So 80% have.
Those young women, the 29 to 39-year-olds
Right.
who are getting breast cancer faster than everybody else, no family history. A risk assessment might not have helped them.
So you just said something. The 29 to 39 years old are getting breast cancer faster than in the.
Yeah.
What do we do? Any idea why that's happening?
It's a separate show, but there are
Okay.
things, environmental things. There are things called endocrine disruptors, right? What's messing with our hormones? What's in our food that we're eating? What's messing with the inflammation in our bodies, right? Our hair products, right? Dyes. There's so many things that are contributing, that we think are contributing. Smoking, vaping, alcohol, sedentary lifestyle. COVID really showed us that the health of this nation is very poor.
Oh, we're absolutely
Right.
the worst. Yeah.
And so then we see these people and we're like, oh, you're too young for breast cancer. You don't fit the mold. But they do. And so there's 2 problems. There's the guideline problem, right? Where people, okay, you're 40 and above. But what if you're a black woman like me, right? We're getting breast cancer 10 years younger,
Right.
more aggressive, later stage. The guidelines say, well, maybe there's not enough evidence to say you should get, additional screening. What about the women with dense breasts? 48% of women, every second person has something called dense breasts. And the FDA says you should get supplemental imaging. We should do more stuff to look. It's like looking at a cloudy sky looking for a cloud. That's the density, right?
Okay.
FDA says you should get more imaging. U.S. Preventive Task Force, those guidelines say, no, there's not enough evidence to suggest that. So there's all this confusion. Meanwhile, women don't know what to do, and they're not getting their imaging every year. And so it's not a problem with the technology, but there is a problem with the process. And that's where Bexa comes in as a really smart solution for adoption. That word,
There's
remember
a
that
problem
word.
with the process. There's a problem with acceptance.
Yep.
Because the women are saying, not so much.
Yeah, I don't want that.
Yeah. I don't. Yeah, I'm busy. I don't have time to mess with that. Yada 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 yada. So we're missing this whole class. We haven't even switched to the those of us that are chronologically challenged yet and where that's at. Okay. And as a result of that, you're having the numbers are starting to creep up now?
Yeah. Because think about it. Every year you go and they call you back and say, oh, you got to get another test because you've got dense breasts, but it may not be covered by your insurance. So now you got to take another day from work. You got to find something to do with the kids, with the elders, something to do with the dinner that you were going to stop and pick up. You got to move your plans and get another test. It could be 2 weeks. It could be 2 months. And then they say, oh, you got to come back for a little bit more. Let's check it again in 6 months. So this process is expensive, right? The process of, we call that false positives, meaning your mammo is inconclusive. We kind of see something and it might not be. That process is so off-putting to women that they say, you know what, I'm not doing that again this year.
And then, if I heard you correctly, and this is interesting because I've been in this industry for 30 plus years, it may not be covered by insurance. So there are policies that don't cover these follow-ups. Mm-hmm. So then the woman, well, I can't afford to get a $1,700 or $2,000 or $3,000 MRI, CAT scan, whatever it's going to be. So I'm just not going to do it.
Precisely. And if you've ever had an MRI, you'll go in that machine once,
Oh.
right? You get that dye and it makes your mouth water and you're like, okay, I'm not doing this again. And so all of these reasons are compounding why we're finding cancers at a later stage. So we got to do something different. We cannot continue to do the same things and expect different results.
Yeah, that's the definition of failure.
Precisely.
And we're certainly failing.
Yeah.
This, you said something last night. We've only got about 2 minutes left. Back to that MRI thing. So I've had multiple MRIs, had a brain tumor in 85, so I've done this. Well, you're on your back going in. How do the women do it when they go in for the breast MRI?
God. Oh, so you're on your stomach in the Superman pose, right? Face turned to the side, staring at the side of that machine, all that noise, all that whirring, even if they play a little bit of music, but it's a completely uncomfortable
You can't hear any music in that thing.
Superman pose.
Yeah.
Now it's better than the smashogram, right? It's better than squeezing it between the two metal plates with 28 pounds of pressure, because that's what a mammogram is. So they're like, well, let's give every woman MRIs, but the MRIs find everything, and then you need ultrasounds after that, and then you need biopsies after that. This whole process. And in the process, the women aren't informed of what's been seen. They get a message in the portal, hey, we saw something, call this number. And what are you supposed to do? You have no idea what's wrong with you.
And what's the anxiety level? My wife suffers from heart failure. The first thing she does when she gets her labs is goes right to the website. She did this yesterday. A couple of things were down. She's like, hold the phone. You don't start interpreting your own information here. Let's go from there. But the level of anxiety is huge.
Right. You could have a cancer.
Yep.
And you may not know what to do for weeks to months.
And that's the problem. All right. So now you know. When we come back from the break, we're going to talk about the Bexa Solution. Now we've framed the problem. We've talked about what's going on. Now we're going to come back and talk about how do we fix it. All right. If you want to learn more, the website is mybexa.com. Mybexa.com. The phone number, 1-800-469-2392. 1-800-469-2392. You want to learn more about this, go to the website or give them a call. You certainly might want to think about this if you've got a self-funded plan in a large employer group, if you're a TPA, even if you're a broker or a human resource director, you might want to take a look at it. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Stay tuned. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. All the shows are posted on 16 podcast channels and the YouTube channel. So maybe you're that broker, okay, that's got 3 clients in the Pareto Contrarian Re or the Berkeley Captive, 400, 200, 300 employees, and you know what that bottom line number is going to look like when the reinsurance bill comes next year because they had 3 major cancer claims, 2 of which were breast cancer. You could do a lot to eliminate that if you understood the Bexa model and how it works. So if you're a TPA, this is something you might want to think about. If you're a broker, you definitely should be thinking about it. All right. And if you're a human resource director, imagine what this would mean to the women in your company if they were told they could get this exam and do it in 30 minutes in the convenience of the office if they wanted to do that. We'll talk about all of that in this segment. To learn more about it, go to the website, mybexa.com, mybexa.com. You want to talk to somebody, call them, ask for Elizabeth. She'll be happy to chat with you. 1-888-469-2392, 1-888-469-2392. Over dinner last night, we talked about a lot of different things, but you told some stories last night. You were probably, I think you've done about 4 or 5 conferences here this year so far, if I remember correctly. Talk about some of because we just talked about the inconvenience that having to lay on your belly and do this thing, 28 pounds of pressure. Talk about what you're hearing when you go to these conferences and women come up to you. Elizabeth?
Absolutely. So there's actually a few different things that I feel like we hear constantly, and it's so sad, right? It's interesting to be on this side of things. I knew breast cancer was a big deal. I just didn't realize how big of a deal it was. And yesterday at this conference that I was at, there were at least half a dozen women who were all breast cancer survivors. That's a lot of women.
Wow.
Yes, exactly. But the interesting thing is that you have these women who do have dense breast tissue. And the moment that Dr. Mo starts to describe what the actual process or journey could be for a woman with dense breast tissue, you start to see this kind of light bulb go off, right? And they're like, wait, there's something different that's out there, right? There's something different that's an alternative to what I'm doing today that fits the needs that I have. The other thing is you have these women who don't meet the age guidelines. And I'll tell you, I tell this story on a pretty regular basis. But there's a family member who is 24 and no family history, and she was diagnosed with what they thought was stage 1 and ultimately ended up being stage 4. And that happened about 2 weeks before I took this job at Bexa. And that to me, like you never really quite think
24 years old.
24, yeah.
Stage 4.
And no family history. So what happens whenever you feel that lump, and to Dr. Mo's point earlier, you go in to see your provider and they say, you're too young, you're fine, everything's normal, come back again. Well, we all know it's not easy to get into your PCP, right? You've got to wait, typically, I know I have to wait 3 to 4 months if I were to go see mine. And then on top of that, now you've got to have a script to even go in for a mammogram. If you have a concern, you should be able to go in and have that done. The other thing that I just heard a story yesterday, we had an examiner that was on site. She was providing demos, and I went and asked this lady how it went. And she said in the past, she's had 2 mammograms, she's 50. Her first one was okay. Her second one was so painful that she literally blacked out and they had ruptured a cyst. And it was because she had smaller breast, but it was this awful story that I was hearing. And then she said, I will never again get a mammogram. And again, we're not anti-mammography, but it's just to say there has to be an alternative solution that's out there. I fit one of the 62% of women above the age of 40 who do not have an annual breast screening. And that's kind of alarming based on the position that I'm in, but it's 100% true. I don't want the pain. I don't want any of that uncomfortable. So it's just, yeah.
So doctor, show the device and talk, how this is different, what it does. This is it. I mean, this little machine that you're looking at right here is the whole device. So explain how this works.
This is it. And the first thing I'll say is this. If you told me 20 years ago that you could poop in a box and mail it, right? And check
well, there you go. Now, that's something I hadn't thought about, folks.
Right? 20 years ago when I started practicing medicine, that you could do that, I would have laughed you out of this booth and said, yeah, whatever, okay, you know? And it's the same thing for every new innovation. So when we talk to doctors, they're like, okay, so if this is so good, then how come I didn't learn about it? How come I don't know about it? It's because innovation is happening, and we have to keep up with it. But how this works is my 10 fingers, right? As magical as I think they are. I'm a surgeon. I think they do wonders.
I'm sure you do.
Right.
I'm sure you do.
The effectiveness of these 10 fingers to find a cancer, to find a mass in the breast is like 50-50 flip a coin. It's called a clinical breast exam. And so what Bexa has done is that on the bottom of this device, there are not 10 fingers, but 192 sensors.
On this
little device, 192 sensors that are arranged like a lattice. And everywhere where those 2 filaments overlap, it sends a signal up. And so as it glides along the breast, right, this is the clinical breast exam, as it glides along the surface of the breast, it looks for changes in the stiffness of the tissue below where it's gliding, right? So think about it like fingers on a piano key, or like hands gliding along something, and you're feeling for the changes in the stiffness. And where there's a cancer, the breast tissue is going to be stiffer. So it's looking for changes in that elasticity. It's stretchy, it's stretchy, it's stretchy. Something's pushing back on the sensor. And it can detect down to 5 millimeters, and that matters. At 6 millimeters, right, a cancer that's aggressive, triple negatives, the HER2 positive, they need aggressive chemotherapy. That cost, all of a sudden, you talk about claims costs, the cost for some of those drugs, through the roof.
Well, yeah, but what the other problem is, you're talking about early detection. using the standard methods where they're not even going in until they're 40.
Precisely.
We're back to the 24-year-old with stage 4 cancer and no history in her family. This changes that.
This changes everything. But what this does, what it does not do is it doesn't tell you if it's a cancer. It glides along, it finds the mass. Ultrasound defines the mass.
So
How
that's what
suspicious.
this is.
This is a handheld ultrasound, right? And so you get 2 modalities in one, and this is important. We're going to come back to this because the cost and the time from a woman having a lump to getting a diagnosis can be weeks to months. I have a friend, she's a physician in Maryland. She's a primary care. It took her 6 months to get a diagnosis of DCIS stage 0, and by the time she actually got the surgery, it was stage 2. Right. And so when you find a lump and you find it small, and we got to talk about this. The reason we search for the lump is because the most common presentation of a cancer that's going to spread, the way it starts as a lump. It starts as a mass. 97% of cancers that go anywhere and that become stage 4 start like this, as a lump. And so if you're going to save lives, if early detection is going to save lives, find the lump, find it fast, find it cheap, tell her what it is, and then tell her what to do about it. And do it in a sensitive and humane and compassionate way, person to person. That's the difference.
They're not waiting 30 days to get through. So this is let's just say the employer sets this up in-house, decides we're going to start doing this. We've had 4 cancer claims. We've got 300 women here in our company, or whatever the case may be. We had 4 major claims last year. Of those 4, 3 were non-detected when they should have been. 2 were below the age of 40. We're going to bring this in. How long does it take to do that exam?
This exam, with the encounter with our examiners that we train, talk to the woman, ask her what she feels, go over the breast exam with her. You get the device, any masses that are found, you get the secondary study, 20 to 30 minutes. 20 minutes, done. 20 minutes you're putting your clothes on, 30 minutes you're signing the survey, and you're walking back to your desk.
And they have the results.
Now, if a mass is found, it gets sent immediately to a fellowship-trained breast radiologist. And, they're kind of like unicorns in this country right now.
Oh, really?
Finding a doctor, a radiologist who just does breast imaging, they are in very high demand, but we have them. And they will read that ultrasound. They'll look at the picture, the measurements. They'll get all the features that our ultrasonographer will send. And they'll say, you know what, this looks like you should check it again in 6 months. This looks like a cyst. This looks like nothing. This looks like you need a biopsy. And so how many women are being referred for that? That's called the referral rate, right? So when you compare how many women after mammogram need more pictures, 13 to 21%. Bexa, 2 to 5% of women are going to need something after the Bexa exam, because we find the mass, we tell you how suspicious it is, and then those 2 to 5%, because that number is so small, they get a call from me or a member of my clinical team that says, hey, you had a breast exam with us. We saw something. Who's your PCP? Who's your gynecologist? Let's get you in to get some more imaging.
And now, let's go back to the insurance hurdle. You have the actual diagnostic information from the radiologist who knows how to read breast exams. So now, the pre-cert to get the rest of the testing done is a walk in the park, because it's medically necessary. The magic 2 words, it's medically necessary, because you just showed them. There it is. Here's the pictures. Here's the analysis.
Yep.
It's all done. Get them in.
Exactly.
That's remarkable.
And if they have problems, they call us, and we find somebody in that market. Every new market we enter, I find doctors who are on standby waiting to receive these women. If they've got a breast issue, they know if I'm calling, they're going to see these women. They're going to get them in.
It's remarkable. You can make a huge difference. Once again, I do these kinds of shows for a reason. This is technology that is not... Most folks don't know anything about this. I certainly didn't before I met Elizabeth. It's remarkable what they're doing. They can change the way we're treating breast cancer in this country in terms of getting it done earlier, smarter, and better. If you want to learn more, mybexa.com is the website, mybexa.com. Phone number 1-888-469-2392, 1-888-469-2392. We'll be right back after the break. The doctor's still in the house. Stay tuned. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. You've got women in your family. You're a guy listening to this. This audience tilts a little bit toward men. We got our women audience capacity is climbing every day. But nonetheless, I'm talking to you guys out there. You got a wife. She's under the age of 40. She's never done this. You need to talk to her. okay? You don't want to be the one with a 24-year-old wife that's got stage 4 breast cancer because she didn't detect it. It wasn't detected early. Let her listen to this podcast. Let her listen to the broadcast. Go up on the YouTube and tell them that it's there because it can make a big difference for them. The website is mybexa.com. It's a great website. Videos are up there. I spent a lot of time on it. Easy to understand. They've got a lot of initiatives up there you'll want to take a look at. mybexa.com. You want to call them, learn about this, learn how you can incorporate it into your company's health plan, learn how you could do it as a broker, as a TPA, whatever, or a human resource director. 1-888-469-2392. 1-888-469-2392. It's a great program, can make a big difference, and can make a huge difference in terms of claims cost as you move forward. All right, so let's talk a little bit about this Net Promoter Score. I saw this, I'm like, okay, what is the Net Promoter Score? So explain that, Elizabeth, and talk about what it is.
Absolutely. So it's important that we have a 98 NPS score, okay? 98%. That's incredibly important, especially in the industry that we serve today, because if we look at this, you're talking about carriers or other vendor solutions that have, teens or even like in the 30%, right? So to have a 98 means that if we were to come back on site, people would opt in to doing a Bexa breast exam again. So they truly love us. And I think the very unique part about what we do is, one, we service self-funded employers. You can be fully insured as well, but the billing's a little different. So self-funded employers is very important. But when we come on site, after an exam is performed, we ask that patient then, or that member then, would you mind filling out a quick survey? The vast majority of women will fill out that survey. I think it's 97% of those women. And then that's where we get our NPS score of 98%.
It's remarkable.
So yes, women love us.
The other thing is, from the employer standpoint, I told you this at dinner last night. If I'm the employer and I got 200 employees, and of that 40% are women, and I bring this program in place and put it in and say, oh, by the way, you guys out there, you want to bring your wives in here because they're covered. Mm-hmm. We'll do it for them. Okay, whatever the case may be. The level of concern and care that shows by the employer doctor is like, they really do give a damn, don't they? I had the folks up here from Exemplicare, and Dr. John said, the best thing that I ever heard when I was actually in the clinic and working was an employee came in from a company and said, this is the only damn thing my employer does me that's any good. And it was like, okay. Well, but so the point is, it's engagement, and it shows, in addition to the ROI at the end of the day, it shows something.
And what it really speaks to is the experience, right? A Bexa breast exam feels like wellness. And your typical breast exams kind of don't have that same sense. And that speaks to the quality of our examiners. They're the lifeblood of what we do. When I train these examiners, I train them to be compassionate, to ask questions, to engage with these women. And no woman ever walks out of the typical breast experience and says, oh, I feel more educated about my breast. Now I understand what I've got going on. They're like, crap, I hope they didn't find something this year. I guess I'll find out in my phone in 1 week, 2 weeks, whenever I get the results. But when women leave, they say, are you going to be here tomorrow? Can I call my sister? Can I call my coworker's on vacation? She said she'll come back early for this. We have gotten those types of phone calls and those types of referrals because you go in, it's a 10 by 12 room, it's a heated massage table, it's warm gel, it's a friendly face asking you questions, showing you what your breast exam is and encouraging you to do your own breast exam at home. And if something's found, she's looking at it right then and there. And she said, we're going to get this over to the radiologist and we're going to get your result right away. Right? That process feels like wellness. That's what women want.
Yeah, it not only does it feel like wellness, it is wellness, okay? Because you're detecting this early, and you're getting them into the protocol where if there's an issue, it's not going to be stage 4.
Precisely.
So let's talk about that for just a second. In this country, unfortunately, we treat things after the fact. Like I said at dinner last night, we put the Band-Aid on, meanwhile you're bleeding out of your femoral artery, okay? How much of a difference does this make, will this make, when you talk about overall the difference between reducing these stage 4, stage 3 cancers versus where we are now?
Those are good questions. And the number one, the cost of breast cancer care in this country is totaling over $29 billion. Right? And stage for stage, when you go up in a stage, you're going up by $80,000 to $100,000 per stage that insurer or that employer is paying, right, for that later stage diagnosis. So when you find it early, it saves money for the company for sure, but think about your employee. right? She now has a longer health span. She's more invested in that company. She has reduced absenteeism because she doesn't need chemotherapy, right? She's going to stay with that company, right? The GDP of an entire nation goes up when we invest in women's health solutions, and that's been shown. McKinsey did a great report on that last year. We talked about it at the World Economic Forum last year. So investing in breast cancer care and early detection is dividends, right? Not just the direct cost, but the indirect downstream costs for sure.
So in the numbers, number one high cost claim, $528,000. Okay. Number two, $419,000. Okay. So you're looking at $1 million in claims here for each and every one that we're talking about.
I'll do you one better.
Go.
The cost of a false positive, right? That cost of the secondary imaging, the possible biopsy that may ensue, the 6-month later follow-up imaging that you need, that cost is totaling $2 billion to the health system for false positives.
And that could be basically eliminated.
It reduced significantly, dramatically. And this is where we've got to get smart about what we're doing, because on the surgical side of things, I'm doing less and less surgery, right? They're doing shorter courses of radiation. Everything's getting smaller and de-escalated on the treatment side of things as we find things early, but we're ramping up on the looking for things side of things, right? We're ramping up on early detection. So now you need a mammogram, ultrasound, MRI, follow it up in 6 months. You need a biopsy, you need pathology. All those costs are starting to snowball. It's a real problem in this country.
And the way to solve that is with this kind of technology.
Absolutely.
And it can make a huge difference.
That's right.
Yeah, thank you guys, both of you, for coming in here. For you flying in here like you did, you changing your plans to be here. When we do these kinds of shows, it makes a difference. And I think this one's going to make a lot of difference. So I appreciate both of you very much. I'll say it again. I do these for a reason. And you're the reason out there in that audience listening to this. There's somebody out there listening to this right now that knows there's an issue. There's somebody out there that's a human resource director that knows she had 3 or 4 women last year that had major cancer claims. I've got a good friend who just finished. She had stage 4 cancer. She's still going through radiology. She's still going through chemo. Okay? She has gotten her hair back. We had lunch the other day. This is a very difficult situation for women, and it's something that can change. If you want to change it, you want to learn, you have to take the first step or nothing's going to happen. It's just that simple, all right? The way to do that is go to the website, mybexa.com. Look at it for yourself, all right? Or pick up the phone, go to the website, and call them. Ask for Elizabeth. Have a conversation. They'll come out. They'll talk to you. Phone number, 1-888-469-2392, 1-888-469-2392. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA here on the HIA Radio Network. Goodbye, America.